Are you joining Medicare in the next few months? If so, please be aware of 4 common Medicare mistakes that people make as they approach Medicare. So I'm going to hop into these so you understand how they work, and you can easily avoid them as well to get the most out of your Medicare. Medicare can be great when you do what's right and best for you. I'm Emily with the Medicare Coach. We're a fee-based independent Medicare consultant, helping our clients easily navigate both Medicare rules and insurance company options to do what's right and best for you. I will include extra resources down below to make your life easy when it comes to Medicare, but let's go ahead and hop into this section. So there are 4 things to be aware of that oftentimes result in Medicare mistakes. The first one is that Medicare has guarantee issuance rules when it comes to Medicare supplement plans. What does this mean? It means that when you first join Medicare, you can do whatever you want to, no matter your pre-existing conditions. And technically, every year during Medicare's open enrollment period from October 15th through December 7th, you can also easily change your Medicare Part D or your Medicare Advantage plan. But in most states, you are not guaranteed every year to change your Medicare supplement plan, unless you live in a unique state with unique rules. So it's so important to pick that right Medicare plan, make that right Medicare decision when you first join Medicare, because we cannot change it every year. I hear from people all the time that say, well, I thought I could change everything every year. That's not the case. Yes, you can change Part D every year and Advantage every year, no worries, but not Medicare Supplement, also called Medigap plan. So the Affordable Care Act rule around waiving pre-existing conditions does not, unfortunately, apply to Medicare Supplement plans in most states. Missing this rule can create an absolute mess later on, and it also impacts how you initially make your Medicare decision, because there are long-term implications when it comes to Medicare. Mistake number 2 is assuming that this new $2,000 medication copay cap applies to all medications, and that's not the case. The $2,000 medication copay cap that came out in 2025 only applies to medication copays for medications that are on your Medicare prescription plan's drug formulary. So a formulary is a list of medications that a plan does cover. So in order for this $2,000 copay cap to apply, your medications must be on the formulary. So people will make assumptions around which drug coverage to pick, assuming that just the $2,000 cap exists. But you have to be clear because not all plans cover the same medication. So please be careful there. Number 3 that I see people make is assuming that premiums are the most important thing. Many people will make their Medicare decision simply on the monthly premium of a plan. And they're missing a lot if you do that. Most plans will still have other copays for doctor's visits, for lab tests, for physical therapy, for medications, things like that. So don't just stop at the prescription or at the plan premium. Look at the other details. Look at the copays, the deductibles, the out-of-pockets. Also, please remember that even if you go on Medicare Advantage, you will still be paying your Medicare Part B, as in boy, premium, unless you're on, say, Medicaid or get some other financial help. But understand how the costs work. People assume that they go on Advantage, they don't have to pay Part B, but that's not the case. Part B happens no matter what. All other costs are on top of Medicare Part B, as in boy. And then finally, please be aware of networks. Different doctors take different Medicare plans. So in most cases for our clients, we're either looking to see if their providers take original Medicare, which tends to be about 95% of doctors across the country, or does your provider take certain Medicare Advantage plans? And if they're on Advantage, which specific Advantage plan do they accept? They will likely not take all of them, so you want to be very clear as to which specific plan your provider accepts. Not looking at networks when you first join Medicare can, 1, lead to making the wrong decision, but 2, to also having really big healthcare costs. So please be proactive. Look at those 4 things: the guarantee issuance rules, the $2,000 medication cap and formulary rules, total costs, as well as networks. If you found this helpful, give us a thumbs up and follow along for more inside tips when it comes to Medicare.